PediGuard is the most essential tool I have anytime I'm instrumenting the spine. Instead of using an inert probe to find my way down the pedicle, I use PediGuard. I use an active device which is giving me feedback about where I am.
Where we struggle is in the smaller pedicles, or the revision, or the scoliosis, where the pedicle is not so big, where it's not so obvious, even on fluoroscopy. That's where PediGuard will make our lives better.
The tool is very simple to use. It does not require any attachments. It does not require any sophisticated equipment. It is a handheld wireless device. It also has a very easy learning curve.
I think that the accuracy of pedicle screw placement still remains a concern for patient safety.
It's a concern because if the goal is to use the pedicle as the anchorage point, we have to maximize the accuracy.
A millimeter of misjudgment could be catastrophic. The literature does suggest that the rate of screw misplacement could be somewhere between 10 to 40%.
If the screw is not in the right position in the pedicle, you can have damage of the neurological structures, the spinal cord or the nerve roots, and you can have a wrong positioning of your screw, and this can lead also to a mechanical failure of the construct.
There are many papers showing that the accuracy is still a problem. Even not having a clinical problem or neurological deficit, we know that we cannot get 100% accuracy using pedicle screw.
If a screw is not in the perfect place, intrapedicular and into the vertebral body, you will lose the bone purchase and lose the effectiveness of your screw placement.
More than ever, we need things to help us, make us more accurate. As we work on older patients, the bone quality is soft, so we really only have one chance, if you will, to put the screws in well and to achieve good fixation from the word go, because it's only going to be worse from there. The bone is soft, the patients are elderly.
Having been involved in MIS surgery for the last few years, the most important reason for me now using PediGuard is the less and less radiation exposure I get when I'm using this device to give me a feedback for my pedicle entry.
I'm very concerned about high-dose radiation within the practice. And this rings true for me very personally because one of my practice partners quite recently in the last 3-4 years passed away from what we believe was a radiation-induced thyroid malignancy. And knowing that radiation is a quantitative, accumulative dose, anything we can do to cut down even at 10-20% would have a tremendous impact on our safety in practice.
Over a lifetime of work, I think it's a significant problem. And it's a problem that's becoming an increasing problem because with minimally invasive techniques, we are using far more radiation than our predecessors were. And even though if you're wearing lead, you have some protection, really the overall dose you're getting is quite significant.
I certainly feel that this is a time bomb waiting to go off. As the role of MI surgery is increasing, I feel that this device can reduce my radiation exposure to a very significant extent, which could be a very important factor for surgeon safety, for my patient safety, and for the safety of my staff who work with me.
Until now, people are not really concerned about this problem. They don't feel the radiation, so they don't see that there is a danger. We see every time, be careful about this, but they continue to stay exposure because they don't know where is the danger.
If you're using radiation techniques such as fluoroscopy for all your screws, and you can cut down at least 1/3 of the radiation, maybe even more once you become confident, then I think you're really doing yourself a disservice if you don't at least try it.
The first step for PediGuard is that we want to improve the quality of what we do during the spine surgery. It's a tool that gives you an information, a sound information, that during the procedure that you are at the optimal place, and if you see or you hear more than there is a change in the sound, then you can anticipate and modify the positioning.
The PediGuard, it's an easy, friendly tool that you can use. You don't have to change your surgical way of doing your fixation. It's just a tool.
There is no change in the technique, just addition of information, and that's for sure it's a safer surgery.
It will change your life in the term of technical surgery.
We don't need PediGuard for safety and because it is a very simple device. Just try.